what is the role of Chinese medicine in cancer care?
The role of Chinese medicine in cancer care. Well, in the United States, oftentimes the role of Chinese medicine is complementary care. So oftentimes we will, at least in our clinic and many clinics in the United States, in the current healthcare system, we support and complement the existing treatments that the patients are getting from their Western oncologists. So we do not treat the cancer itself, but we do support the patient when the side effects of the treatment. So we treat the patient, and that's a very important role, and it's very important that it's a very important aspect.
Like you treat fatigue, you treat their sleeping issues, you
Yeah,
treat
yeah,
nausea.
yeah, exactly. Yeah, the fatigue, the nausea, the neuropathy, the dry mouth from the radiation. All these things. Where in Western medicine, we can help with that, but that's not our strong point in Western medicine. And I'm speaking as a Western pharmacist here as well. So it is. Chinese medicine has a lot to offer on that front, and in other countries like in China and Japan, Korea, this is a very common thing. But here in the U.S., we're a little bit slow to it, but we're moving toward that direction.
Can you do anything for hair loss?
So yeah, so with hair loss, usually from the treatment, the radiotherapy, the chemotherapy, yes, we can actually help with that. So usually patients on their own will recover after a certain amount of time, but assisting that process, right, helping the body recover quicker, absolutely. And there's certain patients that need it more than others, but
How often do you suggest patients come get acupuncture or herbs? Also, one more question in here, is acupuncture or herbs are better?
so it depends. If it's both are beneficial, right? And oftentimes both are employed at the same time. It's not really either or, because oftentimes here in the United States, the acupuncturists also are certified in herbology, so they can offer both. So for neuropathy, for example, which is very common, acupuncture helps tremendously. Where herbs are more beneficial than acupuncture would be like the internal medicine aspect of it, like building up the body, because like the fatigue and just the side effects and all these things, oftentimes stems from deficiency. And you can see some of the patients going through the chemotherapy and the radiotherapy. They're just very worn down, and that's something that herbal medicine can help a lot.
And how often do you suggest patients come get care?
Well, that depends on the individual case. And so in our clinic, we work with oncologists. We coordinate with them. We need to know when are you going through the radiotherapy, right? And then we will coordinate accordingly.
Got it. And very important question, do you suggest any formulas, any supplements, or is it best that a patient come and get individualized care?
So I'm going to say that as a general sense, it's not a good idea to use over-the-counter. So as you know, Chinese medicine is very individualized, and it depends on the patient's presentation, right? So you need to be a subject matter expert in order to choose the right formula for you. And if you just do it on your own, it's very hit or miss. It can help you, but it also may not help you, and it's a waste of time. And I think it's especially if someone who is a cancer patient, especially, you should seek the advice of someone who's trained, an herbalist, acupuncturist who's trained in giving you that kind of like clinical insight.
Got it. Thank you.